what's your reaction to then the provincial government not wanting to be part of the federal pharmacare program?
Yeah, I think I was pretty excited when I heard about the federal program, and I think a lot of us had the sigh of relief. And then we heard that the Alberta government decided to opt out. And it doesn't really make sense, especially because there's no plan to cover Albertans right now. So if there was a plan or if there was something in motion that would replace that pharmacare program, that would have made a lot more sense. But that doesn't exist.
What kind of money are we talking about? What if someone had to put out the money, how much would they pay?
Yeah, so on average, I think someone without insurance would be paying about $1,800 a year for just insulin. Mm-hmm. And that doesn't include things like test strips, glucose monitor, like monitoring supplies, ketone strips. There's a whole bunch of things.
And all the things are necessary, so you're keeping track of what's going on in your body, more or less,
yes,
right?
Yes, absolutely.
Yeah. How would you rate the current provincial coverage for diabetes? Because there is some coverage, right, for medication. Yeah. Where does it stand?
Yeah, so we have provincial coverage for pumps. However, it's really difficult to get into that program. There's a lot of bureaucracy. There's a lot of things that you have to do to get into the program. And right now, I think there's about 4,000 people in that program. However, insulin coverage in the province only covers biosimilars. So if you're not on one of these biosimilars, then you're forced out of pocket to pay.
How does Alberta compare then to other provinces when it comes to coverage for diabetes medication? Is it different throughout the country?
Yeah, absolutely. Yeah. So it's unfortunate to say, but I think Alberta might have one of the lowest coverage compared to other provinces. For example, Nunavut has comprehensive coverage. Nova Scotia has comprehensive coverage for insulin, CGM, so continuous glucose monitoring, glucose supplies, and diabetes medication. And there's a lot of other provinces that seem to be stepping up, like Manitoba, but Alberta seems to be left behind.
Do you find that people are considering maybe moving out of province because of that?
Yes, absolutely.
Really?
I've had a lot of families that we've seen and worked with that have decided to move to BC, which is surprising because the cost of living in BC is quite a bit higher. Mm-hmm. But it ends up working out better for their family in the long run in terms of medication.
What do you think the minimum coverage should be for Alberta?
Yeah, I think insulin, all types of insulin should be covered. But there also should be an emphasis on glucose monitoring supplies. So CGMs and FGMs, flash glucose monitors, should definitely be covered in part, at least.
In response, Alberta Health Minister Adriana LaGrange said, in part, Alberta has some of the most comprehensive public drug programs in the country, covering more than 5,000 drugs. We intend to maintain our current benefit offerings. The federal government can assist us in enhancing our current offerings by not adding duplicate programs or creating unnecessary and costly administrative burdens.